My fear is I don't want to lose her. And that's not just physically part, it's the mental part too. I mean, I told her, I said, I want you to always recognize who I am. That's going to be the most difficult part, is we get to the point when she doesn't know who I am.
Well, I hope I appreciate him to the end.
A devastating reality after 41 years of marriage. 79-year-old Jean Bland was recently diagnosed as having mild cognitive impairment, or MCI. It's a condition that causes her to have more issues with memory and reasoning than is common for her age.
I noticed she was having a difficult time driving, recognizing things. You just brush off thinking, oh, this is, it's just old age. I mean, you're just getting older.
A new study from the USC Dornsife College of Letters, Arts, and Sciences finds that among Americans 65 and older, there are about 8 million more like Jean who have MCI, and more than 90% of them don't know it. That's alarming to lead researcher Soren Mattke, because MCI can sometimes lead to Alzheimer's disease or be an early sign of it. Symptoms of MCI include forgetfulness and subtle declines in cognition.
Getting lost more often, losing track of time, losing orientation, forgetting things more than typical for your age.
Jean didn't want to have anything to do with saying that she had a memory issue.
Well, was it horror? Scared me to death, And I really didn't know how to handle it.
Here you spend all these years with someone, all these great years, and to see that starting to deteriorate, where she can't do some minor functions like balancing the checkbook or cooking from a recipe.
Because symptoms are often confused with normal signs of aging, Dr. Mattke found that mild cognitive impairment is severely underdiagnosed.
We found just less than 8% of the expected cases were actually diagnosed. People of lower socioeconomic status, as well as Black and Hispanic individuals, had about half the detection rate of MCI than white and wealthier, better educated individuals. Brain cells don't grow back. So once you've lost brain cells, they are irreversibly lost. And this is why we need to find these cases very, very early on in this MCI phase, so that we can treat it.
If someone with MCI also has early Alzheimer's disease, treatment to slow its progression can include a newer class of drugs, such as the recently approved Leqembi. But that drug only works when patients are treated early.
This creates a whole new level of urgency. Once you have moderate or severe dementia, you have lost so much of your function that we can't really restore it.
Dr. Mattke's research highlighted barriers for MCI diagnosis, including limited time during doctor's visits, a lack of awareness about the condition, and patient concerns surrounding stigma. And while not all MCI cases are early Alzheimer's or develop into other forms of dementia, experts say patients should not dismiss their symptoms as normal signs of aging.
People should take it seriously whether or not it represents very early Alzheimer's disease. It's part of self-awareness, it's part of sustaining your own health.
Jean and Mike are doing just that. Daily walks to stay active and exploring treatment options with their doctors. This journey giving new meaning to the promises they made 41 years ago.
She always says, you don't deserve this. Why are you doing this? And I said, well, think about our marriage vows. That's why. I'm here, I'm not going anyplace.
I am very lucky, let's just say, very lucky.
I am too.